One of the things, Michael, a lot of folks get confused with is the terms, the Medicare terms that are used within an insurance policy. Stuff like premiums, deductibles, co-insurance, max out of pocket. So I wanted to dive into this today at this episode and explain, not too deeply, but a nice surface level explanation of what each term means when it comes to a component of a health insurance policy. The first thing that we needed to know and we need to discuss is, what is a health insurance premium? So a health insurance premium is the amount of money somebody pays every month to have that hospital plan, that medical plan, whatever the plan is that they have for their medical. Okay. It's kind of like a membership fee. They have to pay this premium whether they use it or not, right?
Yeah.
So that's a health insurance premium. It's the cost monthly of the insurance that you're going to pay every single month, whether you use the plan or not. It's just like car insurance, if you will. You got to pay it every month, right? You got to have it. If we don't have it, you don't have insurance, and you put yourself at risk. So we definitely want to make sure we keep paying our premiums. With a deductible, what do you think about a deductible?
Well, the deductible, again, we get people that mix these terms up, and they'll call up and say, "Hey, I just paid a $20 deductible." I'm like, that's your copay.
Right.
But so a deductible is an amount that is determined by your plan that you must pay before they start paying on your behalf. Okay. So that's whatever that amount is, whether it's 200, 500 or 600, you're going to pay that before it turns into whatever your copay is. And so it's not the same for every plan. Some plans have no deductible. So it's important for the client to understand what a deductible is. And so when we go through a summary of benefit, we try to point that out. But, I get it. They leave and they kind of mix the terms up, and, they'll call me up and ask about their deductible. And I'm thinking, well, they don't have a deductible.
Right.
But then I realized, they're talking about their copay or their co-insurance or whatever it is, but it's not a deductible. So I think it's important, in this segment here, we're trying to clear up the confusion on terminology, because it's second nature for us. We do it every day. But for them, it's not. And so we just want to make sure that there's a clear understanding of what those are. So on one thing I want to mention on the deductibles, usually preventive services, some things on a plan are excluded from the deductible. It could be your primary care and your specialist.
Meaning you don't have to pay the deductible first.
Exactly.
Before you pay your copay.
Yeah. Like there's a particular plan I'm thinking about where the deductible only applies to MRIs, CAT scans, hospitalization, outpatient surgery, but it would not apply to an ER visit, primary care visit, specialist visit, or lab work. So I think that, again, when we go through the plans, it's really important that we detail this out for the client, because that's where they get a little bit of confusion and frustration when they go to the doctor and they are asked to pay $500, and they're like, wait a minute, I thought it was $100. Well, but you got to meet your deductible first. So again, we make sure that we cover that when we go through the summary of benefits. The other thing I was going to mention, when you were talking about premium, sometimes premiums are based on, like on a Medicare supplement or some other products. It could be based on your age or
That's
their
correct.
condition
Yep.
or their location, even their zip code. So premiums do have a factor in on where you are, your age, and maybe a condition you have.
Right.
So, and then, if we segue into the copay.
Right. So co-payments, a copay, this is another thing people get mixed up on. That's why we're having this conversation today. A copay is a set amount of money for a service. Okay. So an example would be, I go to my specialist and I have to pay a $35 copay. So every time I go in, it's always $35. And if I do an MRI and it's $250 copay, it's always going to be that $250 for that calendar year. Things do change each year, so it's very, very wise to give us a call and do a plan review each year, because as you know, copays do change, and when they go up and somebody uses it that next year, they're not happy when the copay went up, right?
Yeah.
They go get an MRI and it was $120 in 2024. Now it's $250. That's a big old surprise when you're expecting to pay $120.
So how would somebody know if their copays are changing? What would happen to let them know in advance? Like if we don't call them, what happens in the year that we give them that information for the following year?
Okay, so in September, late September, early October, our members do receive what we call it annual notification of change. It's not a thick book, but it's what 16, 17 pages long. And what it does, it's got the current year's column, like 2025. Mm-hmm. Then it's got the 2026 next to it for this coming year. And it's going to tell you, all right, here was your copays for 2025, and this is what they changed to for 2026. So you need to keep an eye out. It's called an ANOC, ANOC, the Annual Notification of Change, and you will receive that end of September, early October, and it will let you know what the changes are for next year. There's always a change. It might not be much, but there's always a change. Yeah. So keep your eye out.
But it only highlights the changes.
Correct.
It's not a complete summary.
Right.
Correct? So I know that both you and I, we send out our letters prior to what we open an annual enrollment period.
Right.
And one of the things we try to alert them of is that they're going to receive this document.
That's right.
Because they get so much mail during the year. What do most of them do with their mail?
Throw it away.
They stack it up, throw it away, and then they'll tell you in December, I never got anything.
Right.
I said, well, you probably got it and threw it away, but here's what it looks like. And they're like, oh. So we try to alert them beforehand. Be looking for this document. It's going to give you a snapshot of your copays and coinsurance for the next year. And it's really helpful. And the carriers are required to get that out to them. It doesn't come through our office. It comes from the carrier. So best thing we can do is alert them, hey, look for this booklet. It's coming. All right. So, we've covered deductible, premium, copay. Let's talk about coinsurance.
What is coinsurance?
Well, coinsurance is a percentage of the service that you're required to pay. So let's say that your service is $400 and your coinsurance is 20%. That means you're going to pay 20% of that $400, which is $80. So again, when they're used to paying that copay, it's a fixed amount. They pay the same amount every time they go in for that service, but they go in for something that's got a coinsurance designation with it. It's an undetermined amount. So it's whatever that injection, that procedure.
What would qualify for coinsurance on these plans that we mainly offer? Which benefits would you typically pay a coinsurance on?
Honestly, the biggest one is going to be like chemotherapy would be 20%.
Right.
Renal dialysis would be 20%. Any injectable outside of a shingle shot. So if you go in and get a shot in your knee or a steroid shot in your shoulder, that you're going to pay 20%. Some DME supplies, a wheelchair, walker, canes, those items would be at 20%. So it's often a number, kind of a moving target. So that's why they don't really understand what they're paying, because they don't know what that service
what the actual charge is
costs. But we can easily explain to them that, hey, you're paying 20% of whatever that negotiated price was from the carrier. So, and sometimes to get it down to the exact number, we have to call the provider and say, hey, what was the charge on that? So we can explain to our client why they paid $360 for that item. So again, coinsurance is a 20%, so that the percentage is a defined amount, but the amount for the service or the item is not defined. It's only defined by the provider. So,
correct.
So we need to kind of sometimes uncover that so that they fully understand why they paid what they paid.
Right. So with that being said, this is a good segue into what is a maximum out of pocket. Because we just talked about coinsurance being an undefined amount and it's a fixed percentage. If we're doing chemotherapy or if we're doing Entyvio, Remicade, Skyrizi infusions at the doctor's office, some of those treatments are super expensive. Entyvio, for instance, I'll give you an example. I have Crohn's disease and I do Entyvio infusions, and they bill the insurance $26,000 every time I go in and get my Entyvio. So on these plans, 20% of $26,000, that's what, $5,200. That's a lot of money for one infusion. If we're doing that every month, it's, $60,000 a year. Most people cannot afford that or just don't want to pay that, right? So we have something called a maximum out of pocket on most plans that we offer. Maximum out of pocket is the most money you would spend in one calendar year for services. In this case, it'd be in medical services. So let's say I was on a plan and the maximum out of pocket is $3,900. And I went to the specialist a couple times. I went to the doctor a couple times, and I paid, a few dollars out of pocket in copays. And I go do it by Entyvio. Well, I'm not going to pay the whole $5,200. I'm going to pay whatever the remainder that max out of pocket is till I hit the $3,900. Let's just call it $3,900. I paid $3,900 for that infusion. Well, now I'm maxed out of pocket. I've hit the most money that I would spend in 1 year. So the rest of the year, anything that I do, whether it's doctor's visits, surgery, Entyvio infusions, it's all zero because I just paid the most that I would pay for the whole year in that one infusion. Does that make sense?
Yeah, and to be clear, is that because it's an injectable, it falls under Part B,
medical, correct.
So some people have a confusion of, well, it's a drug. Well, but that's a whole different deductible or max out of pocket. So I think it's important that you made that distinction. Right. It's a Part B.
Let's just dive into that real quick and make that clear. So there are medications that the doctor writes a prescription of. You go pick it up at the pharmacy and it's covered under your pharmacy benefits. And then there's medicines that are administered at the doctor's office. Those fall under your medical. So that's the difference. You got one medication that's administered at the doctor's office for an illness, and that's going to fall under your medical portion of your Medicare, okay? And then we've got the pharmacy benefits where the doctor writes a prescription, you take it down to the pharmacy, you get it filled. That's going to fall under your prescription benefits, which actually the prescription this year is capped at $2,000 max out of pocket, which is great. That went down from $8,000 last year to $2,000 this year. So that's a huge savings for some folks that are on expensive medications.
Yeah. Well, look, I'm on Medicare, and I know that the $2,000 cap has saved me because my medication is about $1,200 a month cost.
Right.
So as it turns out, I only had to pay for my medicine through August of this year, and I will have met that $2,000. And actually, not the whole $2,000 is out of my pocket. I think my out of pocket is around $700.
Right.
But because of the discounted price and the cost
catastrophic.
So August of this year, I don't have to pay for my medicine the balance of the year because I met that. So that's a big change from the prior years where it was $8,000.
Right.
So
huge.
all of a sudden it makes a big difference. I mean, there's a lot of clients that were so used to struggling the last 4 months of the year because they were just getting hammered by all these high costs. And now they're like, hey, it's changed. Now I don't have to pay anything come July, August, September. So I think that is a good change in the industry that we were so glad to be able to implement in
right.
terms of explain to people, because they were just saying, oh my God, that's going to change things. Now, something else I wanted to, because I know through your situation, we've talked about some of the manufacturers do have programs for some of these really expensive drugs outside of their plan. Explain to me or to the audience how that works. When could they get that, or how could they get that?
Sure. So the manufacturer that makes certain medications, especially some of these new medications that are super expensive, they have something called a patient assistance program or copay assistance. And what those programs do, most of them are based on income, but some of the income limits are super high. So a lot of folks do qualify for it. We do assist in that. We have a patient assistance application, I believe, for every manufacturer
right.
In the office somewhere on our computers. So we do help out with that, and it does work. But what it does is they usually have a grant, like a fund, that's got money in it. And if you qualify, that fund pays for the cost of the medication for you. It's pretty great. I do use that for my Entyvio. I pay $5 per infusion.
What does Entyvio cost?
$26,000.
All right.
So that's a big difference.
It's a crazy comparison.
Yeah, it's huge, but we do that for our members today that are on Medicare plans as well. Even if it's not that drastic of a cost, we could still help apply for that, get that approved, and help get that cost down for you.
Yeah, no, that's a great benefit. One thing that does come up quite often is, especially somebody coming on Medicare for the first time, if they were on expensive medication, they'll say, oh, don't worry, I've got a copay card. Well, many times, if they read the rules and guidelines on that card, it says cannot be combined with Medicare if you're eligible for Medicare. So that's a totally different product. That's a card for, like yours.
For commercial insurance.
Commercial insurance. So a lot of times they don't understand why they can't continue to use that. And we just have to direct them to the guidelines for that plan or that card and say, just check that out, call the manufacturer. But what they're probably going to tell you is that, no, that's only for people prior to 65 on a commercial plan. But again, that same manufacturer may have that patient assistance
and most of them do
program,
right.
for especially for those really high cost drugs. So that's part of what we try to be educated on and educate our members on is there's sometimes an option so that you don't have to come out of pocket with all that money. But since CMS reduced that max out of pocket to $2,000, that really cut a lot of that out, because again, in my case, I only have to pay for my drugs through August, and then I'm done for the year.
Right.
So that's really made a big difference. So, let's talk a little bit about Part A, B, and D premiums. Again, a lot of these things we know about the confusion because people call us and say, I'm paying whatever their carrier is, I'm paying them $185 a month. And I'm like, no, that's what you're paying for your Part B. But to clear it up, Part A is a zero. There's no premium for Part A as long as you've worked 40 quarters, in your work history. If you've worked less than that, you can buy your Part A. But most people have worked that 40.
Or they have a spouse that qualifies,
Right.
and they can get spousal benefits.
Yeah, they can qualify off their spouse if their spouse is on Medicare or is already drawn.
Right.
But the Part A there's no cost for that. Where the cost comes in is on Part B. Right now in 2025, the Part B premium is $185. Each year it goes up a few dollars. Last year it was $174.70. This year it's $185. I did see, I think during COVID year, it went down.
Yeah,
a few
decreased
dollars.
once.
Yeah. So in the 15 years
Since we've been in the business,
it's
right.
only gone down once. So 185 is the benchmark now. I don't know what it's going to be next year.
And some people pay higher depending on their income.
Right. And that's probably a whole nother segment.
It is. I don't want to dive into that.
Yeah. There's it's called IRMA, income related adjustment. There's a chart for that. If you're a high income earner, you're going to pay more for your Part B. But the point here is that money goes to Social Security. It doesn't go to the carrier. A lot of people feel like that's what they're paying for their plan, because they always want to say, well, how come Humana or United Healthcare is raising their cost for the plan? I'm like, no, that's Medicare Part B that's going up. It's not the carrier.
Right.
So we always try to clear that up. Now, on Part D, there is no premium if you're on a Medicare Advantage plan.
Right.
So it's included in the Advantage plan if you got a Medicare, an MAPD, with prescription drug
And that's
coverage.
in most areas. We do have some areas that do have a small premium on the Medicare Advantage plans, and they do classify it as a Part D premium.
Right.
Have you noticed that on
Yeah,
the Social
I
Security
did see
letter?
that. Yeah.
And that's
But-
confusing, and we're not trying to confuse you. We're trying to clear this up, but this is a lot of information.
Yeah, I think we have one parish in the local area here that has a premium, but most of them do not. But on Part D, the only time you're going to have a premium is if you're on original Medicare with a supplement, then you're required to get a standalone drug plan.
Right.
That could range anywhere from $0 to $130 a month. And somebody would say, well, why wouldn't I just take the $0 every time? Well, it's based on formulary, what drugs you take.
Right.
We're going to match you up with the plan that's most feasible and most beneficial to you. And the way we do that is by inputting your drugs into a model, and it'll tell us, pretty accurately what you're going to spend monthly and which plan is going to give you the most benefit throughout the year, because there's some of the plans that are lower cost may not cover the drug you need. So that's part of our service, to make sure we're putting you in a drug plan that's going to fit all your drugs on the formulary. Not every formulary is the same. Some carriers cover one drug, the other ones don't. So we just have to do that research, and that could dictate the price. So on a Part D premium, it could range from $0 to $130.
Right.
And once you get out of the premium, then we get into the deductibles.
Right. So one of the reasons we do what we do every day, and the reason we have business and we stay busy, is original Medicare has deductibles, has co-payments, has co-insurance. A lot of folks don't know what those numbers are. So we did a little homework. We put a little sheet here together, and I'm just going to briefly go over this just so you can see the difference between the plan that you have or the one that you might be looking at, and then actually what original Medicare looks like if you had no additional coverage, because it can be a bit pricey. So Medicare Part A deductible, that's whenever we stay overnight at a hospital facility, skilled nursing, hospice, there could be a deductible involved of $1,676 per benefit period. And what a benefit period is, it stays 1 through 60. So if you go in the hospital and you come out and then you go back in the hospital within that first 60 days, you're still within that benefit period. So you wouldn't pay that deductible a second time. But let's say you go in and have surgery and you're out for 3 months and then you go back in. Well, then we got another deductible of $1,676.
So it starts over.
Yeah, you get another deductible. So that's a lot of money, if you ask me, to have to pay and then have to pay over again. If you're staying in the hospital for an extended period of time and you're still in the hospital and you're on day 61, you have a copay now, a daily copayment of $419 per day, up to days 90. Then we jump into days 91 through 150 at $838 per day. And there's no maximum out of pocket here. We talked about the max out of pocket, right? There is none.
To the end.
Yeah. This is where the deductibles, the copays, and all that's coming into play here. To do some math on that. It's a lot of money. I don't want to be on original Medicare only and have extended hospital stay. That can get very pricey.
John, in your time in this business, I can tell you from my experience, how many times have you had somebody that just had original Medicare? How often?
Well, we have a few, and it's a few too many.
Yeah.
But
you know why? It's because usually they don't know.
They don't know what else is out there.
They're a little bit older. They started off original Medicare, and they just don't understand that there is an option there. So that's another mission we have, is make sure that doesn't happen, because that can be very expensive.
Yeah, no doubt. And then going into Medicare Part B, this is anything, any medical services that you receive, and then you come home the same day. So this is where we go. We get our medical services at the doctor's office, the emergency room, physical therapy, outpatient surgery, and we come home that same day. That's an outpatient medical service. There's a $257 deductible for the year on Medicare Part B, original Medicare Part B. But once you hit that $257, you are responsible for 20% co-insurance with no maximum out of pocket, and they can also charge up to 15% excess charges as well. So you're exposing yourself, if you don't have extra insurance, to another 35% co-insurance in essence. That could be where we're at there.
With no limit.
Yeah, that's a lot of exposure, if you ask me.
Well, John, all this has been really good information. I feel like that we do go through this every day with our clients, and we answer these questions. And the reason we wanted to put this out is because maybe somebody we haven't encountered and they don't understand this. But the one thing I can tell you for sure is that that's why we are in the business we're in, is to make sure that people that are on Medicare, they understand all these deductibles, copays, coinsurance, and what their exposure is, because somebody tells them, they may not know. So what we do is we take you in, explain all your exposure, all the options you have, and try to tailor the plan that's best fit for you, whether it's an Advantage plan or a Medicare supplement with a drug plan. And then we try to make sure you understand that we're not trying to take your Medicare away from you. It's not about that. It's about protecting you after the fact. After you have your Medicare, how do we make sure you don't get in a situation where you're really coming out of pocket with a lot of money? So we can really break down the Medicare Advantage side of it and say, we're limiting all your exposure here based on your copays, maybe some coinsurance and some extra benefits. Or if it fits you better, we go into a supplement based on your travel habits, your life habits, where whatever makes sense for you. But we can also make sure you understand that if you're not going to get an Advantage plan, we're going to detail the supplement so that it covers all these scary numbers that came after Medicare. Because again, I mentioned to you, I don't know, I can count on one hand the people I've encountered with original Medicare only. And that's people that were going it way back.
Right.
But in today's environment, there's so much information out there. I think most people are aware of, hey, there's an option beyond Medicare, but what do I do? That's where the confusion comes in. So that's what we do best, is we take them in, lay out all the options, make it clear for them so that when they're making that choice, they feel really good about, hey, this is the direction I want to go. And we help make that decision with them and assure them that they're, yes, you're making the right choice based on what you're telling me you want to happen with your health care. So that's our duty, that's our job, and we love doing what we do, and we encourage anybody that is struggling with their Medicare decision now to give us a call. Set an appointment up, come in and see us, and there's no obligation. Just come in and talk to us so we can kind of do the same thing. We're going to lay everything we talked about today, we're going to lay it out in front of you so we make sure that you're making that decision based on your knowledge, not just what you've heard. Okay? So if you need that appointment, give us a call at 225-408-4100 or visit our website and just let us know how we can help you.
Very good.
Hope you enjoyed our discussion today on Plus 65 Digital. Reach out to us at info@plus65advisors.com or give us a call at 225-408-4100. Make Plus 65 Advisors part of your Medicare process.